Hello, it's Friday, May 31st, but we're actually recording this on Thursday, May 30th. But it must be time for another legislative update from your North Carolina Medical Society. Not been a crazy week, but it's been intense.
A full week.
Full week, yes. Been working on the Senate budget. We'll tell you a little bit about that, but we've got two other bills that we want to highlight first. The first is the delay, the NC HealthConnex bill that we've talked about before. It's House Bill 70. This would make some provision changes as to who has to hook up to the HIE by Saturday, which is quickly approaching.
Coming soon.
Yes. So a resolution of that bill got delayed because of the Senate budget work and crossover and a few other delays. It did pass this week, passed the Senate this week, but then the House wasn't there to receive it. So technically a fix is out there, but the timeline is going to be such that it hasn't gone into effect when the deadline comes along. So we think that's a technicality. That shouldn't be an impediment to folks seeing Medicaid patients if you're in those exempted specialties or provider stats next week. But wanted you to have an awareness of it, that a fix is passed. It's not yet in effect.
But as a reminder, it does include that language that allows for exemptions if you're in a rural area, if you, for whatever reason, can't purchase the equipment. It gives some exemptions, but of course you have to go through the Department of Health and Human Services in order to request that exemption, but that is included in the bill language.
Important stuff.
Yeah.
We also saw the immunizing pharmacists bill move.
So that bill actually went through the Senate Rules Committee and through the Senate floor. So we saw that bill move, and we've talked about that several times. Increases the number of vaccines that pharmacists are allowed to give within the pharmacy. Yep.
And so that goes to the governor now. It may be the 17th or 18th bill signed into law this year. Very few number of bills that have been signed into law so far this legislative session. But one thing that we know is going to go to the governor, we don't know if it will become a session law or not, is the budget that's being debated right now. They're actually taking up amendments on the floor.
As we're recording
this video. A lot of interesting stuff in the Senate budget this year. More compact budget, but very interesting budget. In the healthcare space, the first thing I'll tell you is that there are no rate cuts. There were not any rate cuts in the House version. There are not any in the Senate version. So everybody's still very focused on moving towards Medicaid transformation. We were very pleased to see that the Senate made sure to include the rate increase for our primary care, OBGYN physicians, and that was done through receipt purposes last year and now is directed to become a part of the state plan.
Yeah, so we're excited to see that included. That had been talked about legislatively, but excited to see that within the Senate budget language.
Right. Bunch of other things in there, including some CON provisions, some of which are, all of which are controversial. Who knows if any of those will actually make it through because those are not spoken to at all in the House version. Yep. The IDD slots were expanded in there, so that
1,000.
Those expansion slots that they talked about in the healthcare expansion bill for the Senate, they rolled that in, included it as a part of the budget this year.
DHHS has also moved to Granville County within this budget as well, a policy change that's made within the budget.
A directive to move to a piece of property that the county owns currently and could potentially become the home of DHHS in the future. Again, that's something that's not in the House version, so that will be in controversy as we go into the settling out of what the budget will finally look like between the two chambers.
Also had a few public health initiatives in there as well, some tobacco cessation funding, so we were excited to see that as a public health priority for the Senate.
Also had a good week with physicians coming in on our regularly requested White Coat Wednesdays.
And actually had some good feedback from legislators on how much they appreciate the input that we give them every single week, and that we don't just have one day that our members come down and visit, but that it's a current steady stream. So if you have not registered for White Coat Wednesday, we would love to have you till the end of June is what we're expecting it to be like. So, but if not, would love to have you or have you be doctor or PA of the day. That would also be great. So thank you to Dr. Viola, Dr. Ortiz, and Dr. Hall, who spent all of Wednesday with us from NC Preventative Medicine. It was great to have them talk about public health.
Nice stuff. And you can also be Doctor of the Day anytime in June. that we're still here. 4 more Wednesdays, we think. We're all going to be celebrating with fireworks in our respective home locations. We believe that this is going to be wrapped up by then. But we will definitely bring you back more updates. You can go to our website where Sue Ann's done a comprehensive analysis of the budget, so you can see all the major provisions and some summary pieces there. And next week we will talk to you about how we're reconciling the House budget and the Senate budget and what we're hoping to see the consensus budget to turn out as at the end.
Yeah.
All right. Until then, we hope you have a great weekend, and we'll talk to you soon.